On this Thursday night, an unprecedented postponement in Canada. The pandemic delays Newfoundland and Labrador's election.
No one could have predicted where we would be today.
A surge in COVID cases splits the vote. Who casts their ballot this weekend and who has to wait? Manitoba's deal to buy a Canadian-made vaccine. The province runs out of patience as doses run short. Snowbirds flocking to Florida.
They're all over.
Yeah, oh yeah.
The Canadians defying travel warnings. Plus, finding strength through song. Don't you cry. Opera singers helping COVID survivors catch their breath.
Global National with Donna Friesen.
Good evening and thanks for joining us. For the first time in this pandemic, an election in Canada is being derailed by COVID-19. Newfoundland and Labrador, which had kept case counts low for almost a year, is in the midst of a rapidly escalating outbreak. And now the provincial election set for Saturday has been postponed, but only for half the province. People living in and around the St. John's region, where case numbers are surging, will have to wait to vote in person. The case count keeps rising there. A record-breaking 100 new positive COVID cases were reported today. There are now 210 active cases. That's the highest number in Newfoundland and Labrador since the pandemic began. The province's chief electoral officer says the situation is too volatile to allow the full election to go ahead. The leader of the PC party calls it an affront to democracy that creates two classes of voters. He wants voting postponed across the entire province. Ross Lord has our top story tonight.
Compounding the dread of a midwinter election with a sudden outbreak of COVID-19 is a no-win situation, especially for Newfoundland and Labrador Premier Andrew Furey. His plan to boost a Liberal minority government into a majority by calling an early election has backfired.
The decision was mine. The problems, no one could have predicted where we would be today.
We're pretty well locked down right now.
Despite another day of record cases, the chief electoral officer has decided 22 of 40 ridings will still vote this Saturday. But Bruce Chalk has postponed in-person voting for the other 18 ridings, most of them in St. John's and surrounding communities where the outbreak is centered. In a letter to party leaders, Chalk noted, electoral workers, many part-time and elderly, will not work in the current climate. He added, more individuals will choose their personal health over working in the election, and polls will not be able to open. The province's top doctor doesn't exactly endorse the decision.
Mr. Chalk made his decision based on, I'm sure, quite a number of factors, and, it is what it is. So, I think that if we can do the election this way, that's great.
It takes a lot to postpone elections in Canada. In 1997, historic floods from the Red River devastated farmers and put pressure on elections officials to postpone voting in parts of Manitoba. But they insisted the vote go ahead as planned. COVID-19 is a whole other story. In-person voting in the St. John's area won't happen until a later date. People can vote by mail-in ballot in the meantime. But some voters say it's time to forget about the election.
I think they've got to push it back. We're talking months here. It should be the summer at the earliest, at the absolute earliest.
It's unclear what all this dysfunction means for who eventually wins and whether Andrew Furey's election gamble can still pay off. Ross Lord, Global News.
Ontario's public health experts warned today the threat from the more contagious new variants is real. According to a top COVID-19 advisor, variants now account for between 5 and 10% of all cases in Ontario. Because it's about 50% more contagious, the UK variant could dominate new cases in Ontario within weeks. If strict public health measures aren't followed now, the consequences could be devastating.
But there's little room for error in our response to this threat. We face the very real risk of a third wave and potentially a third lockdown. There will be little time to react quickly because of how fast the variant spread.
Here's the potential impact on Ontario's intensive care units. Because the variant spreads so fast, ICU cases could begin to surge by mid-March. Most people who end up in the ICU are not in long-term care, so the vaccinations underway now will do little to help. What's happening in North Bay, Ontario, is a red flag for what could be coming. An outbreak in an apartment building there has grown. Out of 24 cases, at least 18 are now confirmed to be a variant of concern. Testing is still being done to determine which one. A person who lives in the building and had traveled internationally first tested positive on February 2nd. To try to limit people moving around, March break in Ontario has now been postponed until April 12th. The education minister says the decision was made in part to discourage travel and prevent people from gathering outside their households.
We recognize that congregation is a key driver of the spread of COVID-19, something we realized over the winter break, and we will not take that risk again.
Students in Ontario are only now beginning to return to classrooms. They switched to remote learning because of a spike in cases after Christmas. Manitoba's premier is making his own deal to buy vaccines separate from the federal government, and it's a vaccine that, if all goes as planned, will be made in Canada. Clinical trials are only just beginning, so it's not something that will happen soon. But as Abigail Bimman reports, it looks like other provinces are planning to follow suit.
Canada First is in danger of becoming Canada Last.
Frustrated by a slow vaccine rollout, Manitoba is going it alone, buying 2 million doses from Providence Therapeutics, a Canadian-made mRNA vaccine that's only in early clinical trials. And unlike the federal government, the premier promises to release details of the contract once finalized.
I have written to every premier telling them about today's announcement and inviting them to partner with the company of their choice that may be available to assist us in building a Canadian-made solution.
While he said Ottawa wouldn't take his call, the CEO of Providence Therapeutics says other premiers are already calling him, though he won't say which ones. He plans to lock down domestic orders for this year by early next week, hopeful for Health Canada approval in the fall.
We fully expect that the provinces that have placed orders with us will have vaccines, in their freezers waiting. And as soon as that approval comes, they'll be able to roll them out.
There's always, economies of scale, and it's always, in some ways, better for quote that sort of the government of Canada, as a bulk sort of buyer on behalf of Canada and the provinces and territories.
As for how those bulk agreements are going,
2.4% of Canadians have received at least one dose of vaccine, and 0.5% have received 2 doses.
We're approaching something that we're calling the big lift, which is the phase in which we go from vaccine scarcity, as we are right now, to receiving millions upon millions.
Next week, Pfizer shipments will ramp up. Officials gave new numbers for the next 4 weeks, with more than 400,000 doses coming each round. There are new details about the next Moderna shipment, too. We'll get 168,000 doses the week of February 22nd. Another cut, this time fewer than 70% of what we were originally expecting. Abigail Bimman, Global News, Ottawa.
There is confusion over the federal requirement that travelers who arrive in the country by air must quarantine in a hotel for 3 days at their own expense. The Prime Minister announced it 2 weeks ago, but the plan is not fully in place yet. The Alberta government is calling for more transparency around the rules. And as Heather Yourex-West reports, some who have already stayed in government-approved hotels are sharing what happened to them.
And now I'm being held here.
It is a rare look inside a federal quarantine facility, one of 11 hotels being used across Canada to quarantine travelers the Public Health Agency determines to be a risk. Calgary's Mitch Beaulieu says he was taken here in late January following a work trip to Florida.
The place wasn't bad. I'm not complaining the fact that, whatever, they put me in a hotel and I had to stay there for 3 days. That's fine.
But Beaulieu is taking issue with the little information he was given about why, even though he had a negative COVID test, he was taken to the facility. Angelo Venegas has a similar complaint. He had a negative test result after a recent trip to Mexico, but he was taken to a facility because he had family members with health issues at home.
I was not aware of that specifically because I have my own room, I have my own bathroom. So as long as you isolate yourself at home, I thought that it was not going to be a big deal.
It's because of this confusion that the Alberta government is asking Ottawa for clarity. In a letter addressed to Public Safety Minister Bill Blair and Health Minister Patty Hajdu, Alberta's Health and Justice Ministers write, "The lack of clear communication has created confusion and fear about unlawful detention, which will erode Canadians' trust in their governments. As the government of Alberta, we demand a clear and definitive explanation from federal officials on the travel quarantine policy and how it is applied."
I think certainly more information and clearer information is always better and is always going to be beneficial.
The Public Health Agency of Canada says travelers must present a negative COVID test and a valid 14-day isolation plan, adding that further details will be announced in the coming days. Heather Yourex-West, Global News, Calgary.
Bombardier is laying off more employees. The Montreal-based company is cutting 1,600 jobs, mostly office employees. And by the end of the year, Bombardier says it will stop making Lear jets. The private planes have been in service since 1963. Bombardier has become a shadow of its former self, having gone from making planes and trains of all shapes and sizes to essentially just business jets. COVID-19 is dominating most headlines, but in BC, deaths from drug overdoses have reached a grim new milestone. More than 1,700 people died due to illicit drugs in 2020. That's the most in any year since the province declared a public health emergency in 2016. More people died of drug overdoses in 2020 than car crashes, homicides, suicides, and prescription drug-related deaths combined. Most deaths were caused by a toxic illicit drug supply, but officials say social isolation caused by that pandemic made the situation worse. Ontario's police watchdog has confirmed a child who was killed during a confrontation last November was shot by the police. A 33-year-old man and his 1-year-old son suffered gunshot wounds during the interaction. The baby boy died at the scene. His dad died in the hospital nearly a week later. The Special Investigations Unit says 3 officers opened fire on the man after his truck crashed into a cruiser while police were laying down a spike belt. They were investigating an alleged kidnapping at the time. New details are emerging about allegations involving Canada's former top soldier. Last week, Global News revealed allegations that General Jonathan Vance behaved inappropriately with 2 female subordinates. Now we're learning of a 3rd investigation dating back 6 years. Mercedes Stephenson broke this story and has more details tonight. Mercedes.
Donna, Global News has learned the Sensitive Investigations Unit of the Canadian Forces Military Police opened an investigation into allegations of inappropriate behavior by General Jonathan Vance in 2015. The military says those allegations centered on Vance's conduct while he served as deputy commander of the Allied Joint Force Command in Naples, Italy, a position that he held from 2013 until July of 2014. Sources tell Global News the investigation was into questions over whether Vance had an inappropriate relationship with an American JAG officer who was his subordinate in Naples. That officer is now his wife. In a statement, the Department of National Defense told Global News that the investigation did not meet the elements of the offense to lay charges under the Code of Service Discipline or the Criminal Code of Canada. But investigators will not disclose what their probe involved, including whether electronic communications were reviewed. The force also did not disclose the findings of the investigation. Military sources have raised questions about how robust the investigation was, including whether any potential witnesses were interviewed. Global News spoke exclusively to the retired 3-star general who succeeded Vance in Naples and who was in command at the time of the investigation, retired Lieutenant General Mike Day. He told Global News, quote, "I was told there was an investigation, but to the best of my knowledge, nobody in the Canadian contingent in Naples was interviewed. Given that an investigation is now reopened, I think it would be inappropriate for me to comment further." This is now the 3rd set of allegations of inappropriate behavior made against the former chief of the defense staff. Vance has denied all allegations of inappropriate behavior. He also says he was never in a relationship with his now wife while she was under his command, and that their relationship did not commence until he returned to Canada and she was no longer under his command. Donna?
Mercedes Stephenson in Ottawa, thanks. Now to Washington, D.C. and the impeachment trial of former President Donald Trump. During their final arguments, the Democrats tried to cement their case that the violent mob of Trump supporters that stormed the Capitol was acting on his direction. They used the rioters' own words as evidence, and as Jackson Prosco reports, Democrats believe Trump could incite more violence if he's not convicted.
We were invited by the President of the United States!
The words of the Trump supporters who stormed the Capitol.
I thought I was following my president. I thought I was following what we were called to do.
Were presented to the impeachment trial as evidence of his alleged incitement and control of the mob.
The president told them to be there, and so they actually believed
they would face no punishment.
The final day of arguments took senators through Trump's history of promoting political violence, from his early rallies to Charlottesville to January 6th and the days that followed.
I also want you to know that our incredible journey is only just beginning.
And he was right. Unless we take action, the violence is only just beginning.
Democrats warned of Trump's lack of remorse and his failure to correct his big lie about a stolen election.
He does not say the one sentence that would stop future political violence. The election was not stolen.
The jarring evidence presented so far has stunned even those who lived through that horrific day.
The evidence that has been presented thus far is pretty damning.
President Biden suggests it may even sway some Republicans.
My guess is some minds may have been changed, but I don't know.
But likely not enough to convict Trump. It would take 17 Republicans joining with Democrats. That would form the basis for barring Trump from running again.
So, if he gets back into office and it happens again, we'll have no one to blame but ourselves.
Trump's defense is likely to focus on his right to free speech and claims he did not incite the mob. And for those who are uncomfortable with Trump's actions, a constitutional argument that he cannot be impeached as a now former president. Democrats have now wrapped their arguments, and Trump's defense team will begin its presentation on Friday. Things are moving so fast that a final vote could come as early as Saturday, which will all but certainly result in Trump's acquittal. Donna?
Okay, Jackson Prosco in Washington, thank you. The pandemic is not interfering with everyone's travel plans. Coming up, the Snowbirds who insist on flying south for the winter. The Canada-U.S. land border remains closed to all non-essential travel, but that hasn't stopped some snowbirds from heading south for the winter. Our Mike Armstrong was in the U.S. covering another story in Florida, and he talked to some Canadians who didn't want to give up their winter in the sun.
The third one down here on your left, that's a Canadian.
About half the owners in this mobile home park are Canadian snowbirds.
There's 3 in a row right there.
Although when Richard Decker starts pointing them out,
hey, Jane,
it feels like even more.
So they're all over? Yeah, oh yeah.
Well, this winter, most of Decker's neighbors have stayed in the north. Most, but not all.
Tons of people in this, let's put it that way.
Len Simmons is down from Toronto. He flew to Tennessee, met his girlfriend, and drove the rest of the way with her. Simmons figures 80 to 90% of the other Canadians in the park didn't come down, but says for him that wasn't an option.
I'm not staying up in the cold weather. I've been coming here for 30 years and I'm not staying up there in the cold weather.
No U.S. state gets more Canadian tourists than Florida. In a normal year, about 4.1 million make the trip down. This isn't a normal year. The Canucks who've come disregarded the government's warnings.
We both flew Air Canada.
And in Margaret Johnston of Newcastle, Ontario's case, also ignored the pleadings of her sons.
You sure you want to go, Mom? Yes. Oh, well, stay safe, Mom. Don't do this, don't do that.
One thing that's gotten harder to do for snowbirds is to get vaccinated. Florida has tightened the rules to cut down on so-called vaccine tourism. People now have to show proof of residency. Another issue is insurance and the chance of catching COVID-19 in the U.S.
We've had Canadians come down and they have had it a couple of days after they arrived.
We tracked that couple down. They're now back home in Nova Scotia, but after a mix-up with their insurance provider, they're now looking at a massive $300,000 bill. It's a cautionary tale, but one that's still being ignored by people who insist they can just take precautions.
When we go shopping, it takes nerve.
Both women have their return flights booked, but with the Canadian government adding new rules, testing and quarantining, their plans are going to change. Leaving Florida and going home is getting more complicated and more expensive. Mike Armstrong, Global News, Largo, Florida.
This little piggy hit the arcade. Still ahead, new research into the intelligence of pigs. They call this an ice volcano. It's in southern Kazakhstan and has caused a bit of a tourism boom there. It's about 14 meters tall. It's caused by water from a hot spring spewing out and freezing, causing a tower of ice. A smaller one was spotted along Lake Ontario this week, formed by waves under the ice. And you know it's cold when even penguins aren't going outside. That's the case at the Calgary Zoo. They canceled the penguin walk today, saying the extreme cold puts too much stress on the birds. It dropped down to minus 27 degrees in Calgary today, but it feels like minus 40 with the wind chill. The penguins don't go for their daily winter waddle when temperatures dip below minus 25. It's well established pigs are smart. They can use tools, learn how mirrors work, and display sensitivity to their peers. Now there's proof they can play video games. In a study published in Frontiers in Psychology, researchers trained 4 pigs to toggle an arcade-style joystick with their snouts. The pigs understood the connection between the stick and the game. Researchers say that is no small feat. They kept at it even after the dispenser that rewarded them with food broke. Researchers gave them verbal encouragement, and they moved to higher game levels. The lead author, who's been researching this for decades, says this confirms how we interact with pigs and what we do to them impacts and matters to them. We take for granted the ability to breathe until a deadly virus quite literally takes people's breath away. Even some people who recover from the worst of COVID-19 have debilitating damage to their lungs. Now, the English National Opera has come up with a program using singing exercises to help. Crystal Gamansing explains.
Sing! Just say it with me. Sing!
Warm-up routines, vocal stretches, breathing exercises, they're all tools that help singers engage their bodies. Singing specialist Susie Zumpa has taken her expertise from the stage to her living room. Everyone in this training session is a COVID-19 survivor struggling with breathlessness. Even singing simple songs proved helpful for this group.
People, when they come to this, are often feeling so desperate and have been managing things that feel really difficult for a very long time.
E&O Breathe is expanding across England. It's estimated there are around 300,000 long COVID patients in need of help, and that's just in the UK.
I can't satisfy my lungs. Like I need that big gulp of air right now.
It's been 11 months since Elaine Dirk was infected. St. Paul's Hospital in BC was the first in Canada to set up a COVID-19 clinic, investigating the ongoing health challenges of survivors. But there's nothing like E&O Breathe.
In, 2, 3, 4.
What makes it different, what makes it unique is the fact that you're being told the benefits of it and you're experiencing the benefits of it.
Being able to use skills and expertise in new and different ways that can have direct impact and positive impact and benefit for patients at the moment is hugely rewarding.
Knowing the benefits, Jenny Malka says international expansion is possible, giving hope to those like Dirk.
I'd be willing to try anything to get myself back to where I was.
The E&O Breathe team stresses being able to carry a tune doesn't matter. The focus is on feeling better.
Rest your head, breathing deep.
Crystal Gamansing, Global News, London.
And that is Global National for this Thursday. I'm Donna Friesen. Tonight's Your Canada is a shot of cold and sunny Calgary. Please email Your Canada to viewers@globalnational.com. Thanks for watching. Robin Gill will be here tomorrow. I'm back on Saturday with the new reality and a look at the variants and whether we're in the calm before the storm. Take care of yourselves. Bye-bye.